morning and welcome to Woodbridge, the best town around. My name is John McCormick. I'm the mayor of this great town, and we're here today to welcome our three favorite non-local state legislators to Woodbridge Township. I'm talking about Of course, we're talking about my good friend Craig Coughlin, Assembly Speaker, our longtime 20-year Senator Joe Vitale, and of course our great Governor Phil Murphy. Governor Murphy is no stranger to us in Woodbridge. Way back in 2005, when I was the state treasurer, I had the pleasure of serving with him on Governor Cody's benefits task force. We got to know each other. We kept in close contact. And then back, I guess, around 2014, when he started thinking about running for governor, I believe his second stop ever was in Woodbridge, where Carol and I had breakfast with him at the Rio Diner. We encouraged him to run for governor. I'm thrilled that he's our governor. He's doing a phenomenal job here for the state of New Jersey. He was, as I said, he's been in Woodbridge a lot. Just Monday he was here in Woodbridge. His office called me up last week and said the governor has some time on Monday. Do you have any veterans events? I looked at my schedule. We had 11 veterans events. But he wanted to come at 11 o'clock, and we had one in Island with our VFW. And the governor came and gave a stirring speech, and all the veterans in the town that were observing it were absolutely thrilled with that. So before I introduce the governor, I do want to say how much I admire Craig Coughlin, who's been my friend for 25 years. This bill is his baby. He has worked so hard on this, and I can't tell you how proud he must feel, and I'm looking forward to hearing what he has to say. But this is Craig's bill, and this is probably his signature accomplishment so far in what will be a career full of signature accomplishments. But without further ado, ladies and gentlemen, the great governor of the state of New Jersey, Phil Murphy.
Thank you, man. I appreciate that. Hard to know what to say after that. Just say, you're right, I'm great. Hey, thank you. Always good to be in Woodbridge. Thank you for having me. I've driven by this building, I was saying to Mac, 50 to 100 times. I've never come in it, and it's extraordinary. And Woodbridge tonight is celebrating its sesquicentennial.
350th anniversary.
Say that 10 times quickly. They're set up back for that. But to everybody in Woodbridge, leadership beginning with John and the whole team, congratulations on a great anniversary and a great job. Special day at many levels, including June 1st is my son Charlie's 17th birthday, and he's God willing, right? So he's working. He's very close to getting his driver's license. So until I let you know otherwise, stay off the roads in Monmouth County. I love him. God bless him. Good morning again, Mac. Thank you, as always, for your gracious welcome to this wonderful community. You mentioned that I started my week on Monday, and I'm ending it on Friday. And that's not a coincidence. Today is a big, big deal day for New Jersey, but I will tell you, we had a solemn and really moving event on Monday, as I had in several other venues around the state in honor of our veterans, and it was in Island. It was a pretty extraordinary hour to spend with you then, and it is today. We are all here today to declare an end to the days of surprise medical bills. Yeah. Today, we are opening a new era of transparency and affordability for New Jersey's healthcare consumers. Today, we're finally going to close the holes in our out-of-network rules that cost New Jerseyans more than just money, but in many cases, the peace of mind that their finances shouldn't be ruined because of a health emergency. It's great, in addition to being alongside Mayor McCormick, to be with my friend and my two friends to the left, Assembly Speaker Craig Coughlin and Senator Joe Vitale, in the heart of their legislative districts. I might add, to sign legislation that they have been working on for a long, long time. You guys think it's somewhere in the 10 to 12 year range? It is long overdue. Today is long overdue. Especially for you, Speaker, having experienced yourself the shock of a surprise out-of-network bill and living the very real concerns of countless residents, I know this is a huge win. I'm proud to have supported you and Senator Vitale as you championed this effort, and we wouldn't be here without you guys. Congratulations. Not only is Woodbridge, in many respects, in Middlesex County, and Chairman McCabe is with us today, my home away from home, but the Rio Diner, in particular, is my home away from home. Not only did John and I meet there, re-meet again, but I remember the very first meeting, Joe, you and I had was at the Rio talking about out-of-network, and here we are at long last. I'd also like to recognize Acting Commissioner of Banking and Insurance, Marlene Carita, who is with us today. She is alongside our Commissioner of Health, Dr. Sharif El-Nahal, Dr. E. And I also have to give a shout out alongside Dr. El-Nahal to sponsor Assemblyman Gary Scher is in the house with us. Thank you, Gary. Who was also there at the very beginning of this effort. And I don't think Assemblywoman Pam Lampett is here, at least I haven't seen her. So in absentia, I want to give Pam a shout out. This is not an isolated problem needing a narrow solution. This is a widespread, truly statewide problem that requires comprehensive reform. And today we're signing that comprehensive solution. Each year, nearly 170,000 New Jerseyans receive medical bills they didn't expect. Bills for services that ended up being performed, unbeknownst to many, by professionals outside their health insurer's network. In fact, yesterday's release of the Rutgers Center for State Health Policy's 2017 New Jersey Health and Well-Being poll bore this out. 1 in 7 adult respondents said they received a surprise large medical bill in the past year from a provider they did not themselves choose. These surprise bills total roughly $420 million annually. They have pushed many families' finances to the brink, and the haggling between insurers and providers over these costs only adds to residents' headaches. And, importantly, the cost of this out-of-network problem is more than double in the way these surprise bills have driven up premium costs for the rest of us, estimated more than $950 million per year. Freeholder Director Ron Rios is in the house. Ron, I didn't see you there, man. How could I miss you? Come on. I also started the week with you and we're ending it together. But just think about those numbers. The $420 million direct cost from people who are getting screwed, but the knock-on impact of the rest of us paying higher premiums because of that of another $950 million. The out-of-network loopholes in our law are a billion-dollar headache, over a billion-dollar headache for all of us. With this law in place, hopefully, not only will surprise medical bills become a thing of the past, but consumers across the state will see lower insurance premiums. And we've signed a series of bills this week, and again, I want to give Joe a shout-out because he's been involved in all of them, and they wouldn't have happened without the Speaker's support, with the collective effort to make the healthcare system more transparent, more affordable, and more accessible for more New Jerseyans. So this law, first of all, it strengthens disclosure and transparency requirements so consumers will clearly know before they receive any healthcare services whether the healthcare provider or facility they have chosen is in-network or out-of-network, along with an estimate of the costs they could be incurring and their responsibility for paying such costs. In addition, insurance providers will be required to provide notice of any changes to their network, along with detailed information regarding their policies for out-of-network services, and to operate a telephone hotline to address consumer concerns and questions. This law will also help restrict the amount an out-of-network healthcare provider or facility may charge in excess of that patient's in-network deductible, co-payment, or co-insurance amount. This protection is especially needed when the need for healthcare is urgent. Residents should not have to worry whether an emergency trip to the hospital could be potentially bankrupting. And when insurers and healthcare providers cannot agree on an acceptable amount for reimbursement of an out-of-network claim, this new law will institute a simple and effective arbitration process. Many call it baseball arbitration, so claims don't drag on and policyholders can reach closure sooner. These changes to our healthcare delivery system, increased transparency, stronger consumer protections, and a way to more effectively resolve disputes are necessary to help contain the ever-escalating costs of care. They will help save residents money. and they can help save taxpayers money in the long run as well, as these reforms play out through our state health benefit plan for public employees. It's taken, plus or minus, we were discussing, as I mentioned a minute ago, a decade for us to get here. Senator Vitale and Speaker Coughlin, along with their colleagues and advocates, have run up against every possible interest group working against these reforms to protect their own profits. But today, at long last, New Jersey's consumers win. Hey, hey, hey. Yeah. I congratulate you both on getting this bill through the legislature along with Gary and Pam and your other colleagues and to my desk. I made closing the out-of-network loophole, in fact, born of that conversation, Joe, with you at the Rio, a pledge in my campaign, and I am proud today, along with you, to make it a promise kept. Before we get to the signing, I'd love to ask each of these gentlemen to say a few words. I'd like to first ask my friend, Speaker of the General Assembly, Craig Coughlin, to come on down.
Thank you, Governor. Thank you, Governor, and thank you for your support and commitment. You have done terrific things for the 9 million people of New Jersey and their consumers because, as the Rutgers pointed out, there was 1 in 7. There's probably no family that I know who hasn't been either directly or indirectly affected by a surprise out-of-network bill. So the 1 in 7 may be the people who got it this year. If you take one step off, it's probably closer to 6 out of 7. But today that all changes. And I'm humbled that so many of you have come out, so many friends who have listened to me whine and complain over the past 4 years. My friends from the Council President Debbie Mee and Councilwoman Nancy Drum, and the members from the Freeholder Board who are here, thank you very much. And folks who I had the chance to walk and talk with about this over the course of the thing. It has been a long time. Now, I think what probably would have been more fitting, we don't want to not celebrate your son's birthday by signing a bill, but what probably would have been more fitting is if we had done this last week, because as so many of you know, they're smiling because here's what evolved. We worked very hard at putting this together and taking input from people across the spectrum of this issue, and it is a very wide and broad spectrum, and there were lots of people. We typically did it on the Friday before a holiday weekend, so the day before Memorial Day weekend, the day before Labor Day weekend, the day before 4th of July weekend, and we did it more than once. Sometimes at the end, it just became sport to see how many people we could actually get there. So probably we should have signed it last week. But this is good enough. And it is a big deal, as the governor pointed out. It's a big deal for the people of New Jersey because think of this. This is what I always kept in my mind as we went through it. We all recognize that when you have to face a medical procedure, it is often at a very difficult time in your life. Often you're scared. Sometimes you don't know what to do. You don't know what the outcome is going to be. And people try to do the right thing. They try to, and it happens a lot. You go to your in-network doctor, you go to the in-network hospital, and you think you've done it right. And then you come home, and imagine being somebody who doesn't have all of the wherewithal to pay a $10,000, $100,000 bills. The bills can really be that high. Think of the pressure on that, on top of having whatever procedure they did, even if they thought they did the right thing. And as the governor alluded, I had it happen to me. I had my gallbladder out in December of 2016. I'm fine. Just in case everyone, I'm fine. Thank you. But there was a doctor I went into the emergency room, so all should be covered. And we got a bill from a doctor, and we started the process of fighting through it. Ultimately, they put me in collections, and finally we worked it out. But I'm in a position to be able to understand what the rules are and to stick up for myself, but so many people are not, and that ends today. But the bill does more than that. It enhances transparency. It creates an arbitration system, as the governor pointed out, and mostly what it does is it sticks up for the people of New Jersey. So this is a terrific bill whose time has come. It has been 10 years. Only took me 4. I don't know what the heck Vitale and Gary Scheer were waiting for. Well, I'm just saying. Um, all right, all right. But Vitale goes next, so be careful. And this didn't happen without an awful lot of commitment. You'll hear many of the advocates who were here, who have been here, Citizens Action and the NJEA and CWA and Ward Sanders and the plans have been terrific supporters throughout this process. People from NJBIA, Mary Beaumont is here. Everyone, and I'm sure I'm missing a half a dozen people who worked hard and were committed to getting this done. But we deserve to shout out my friend and colleague, the former chair of the AFI committee, Assemblyman Gary Shear. Gary, why don't you stand up and give everybody a round of applause. Gary took this on, and he led that fight for 6 years before we got to work together. And we would not have done this without your leadership and without your commitment. And Gary, thank you very much for being here today. Thank you for all your hard work. This is your victory as well. Thank you, Gary. He couldn't be here today, but Senator Singleton was also a member of that group, and we worked awfully hard together. I'm not kidding. We had literally hours after hours of meetings and gatherings, as I said, usually before a holiday weekend. And we worked very hard to get so many people on board, and that is a product of their tenacity. So Gary and Troy, thank you for that. And of course, no one could ask for a better partner than Joe Vitale. He is a preeminent healthcare specialist in the state of New Jersey. He is deeply committed, and he is the best senator around as far as I'm concerned. So Joe, thank you for that. Tamora and Dina Collins Group from Citizens Action, the folks at the Hospital Association who are always willing to talk and ultimately willing to sign on, even before it became inevitable. No. But thank you. Neil is here. Betsy is not. But thank you to the Hospital Association, Ward and Sarah. Thank you to the best staff anyone could ever have. Where is Lori McCabe? There she is. When nobody thought this could get done, Lori knew it would, and she is among the chief architects of it, probably the chief architect of all of this. Where's Dan Harris? Anybody who knows me has seen Dan Harris with me for 9 years. And the rest of my staff, where's Stephanie? And everybody, where's everybody in the back? Everybody who worked so hard. Crystal and Samantha, thank you all so very much. To the folks at OLS, Phil is here, Phil Janice is here, and I don't know if Rich Corbett is here, but thanks to both of them. Thanks to my friend Trish Zita, who gave me a tutorial on how to get this done, and it finally worked. Trish, thank you very much. Thank you to Senate President Sweeney, without whose support this would not have happened either. As I said, this is a terrific day, and I thank you all for giving me more credit than I deserve. This is the product of an awful lot of people recognizing that something needed to change and then went about making that happen. So thank you all. Thanks for coming out. Have a great day. Governor Murphy, I can't thank you enough for being willing to sign this bill and for coming here to Woodbridge. I appreciate your keeping your promise, and I appreciate your friendship. Thank you so much. Thank you, everybody. And now, it's my pleasure and privilege to introduce my dear friend, somebody I hope I took away all of his talking points from, Senator Joe Vitale.
Yeah, just a little bit, Speaker. But I wanted to echo a few things. Early on, all the comments have been if not for so-and-so who wouldn't be here today. The other day I gave an award out to a veteran, and I get emotional talking about it. I didn't know this about him. And on Memorial Day, we had an event. We send some of our veterans to the Fleet Week. And so every year I give out a resolution to someone, to a veteran, for their years of service to our country. But this year was really special, and I didn't know that about him. And truly, if not for his actions and the actions of men and women like him, we wouldn't be here today. He literally traversed 300 yards of open territory under heavy enemy fire to bring back and care for one of his fallen comrades. I had the honor of giving him a Bronze Star last week. Stu, bring him back. That's all I got. It's truly amazing, 10 years, and I want to also single out some of them and share. In the past, whenever I talked about this, I used to say, hi, my name is Joe. I'm involved in network discussions, and I'm going to send you the bill for my therapy, so I want to thank you for your hard work. But he asked me years ago to participate, and it wasn't easy, and it wasn't easy all along the way. This legislation changed almost every time we had a discussion about it. We had sensing meetings, and Linda from the Quality Institute and so many others who were involved in this process worked with us to bring all the stakeholders to the table, to hear from them, to listen to them, to gripe, to complain, to agree. But literally almost every time we met, we came away with another opinion, something that was valid, a change in the legislation to move us along the way. And I think everyone agreed, even those who opposed the bill even today, that people shouldn't be surprised by these medical bills. But the process is, how does that happen? And when you're talking about literally millions and millions of dollars, that changes people. That changes the discussion. And no one wants to lose money. But on the other hand, our dedication from the very beginning with the speaker and others was to make sure that consumers were the ones who were protected. And through the help of everyone in this room, especially on this side of the room, who see the unions and the advocates and the interest groups and Citizen Action and everybody else who worked with us along the way, wouldn't be here today. I can't believe it's been 10 years, feels like dog years. But it's happened, and I sometimes wake up and say, did it really happen? Because it's almost insurmountable. Because the money actually did matter at the end. That was what the fight was over. And when money is involved again, it changes people, it changes the discussion. But we were steadfast, the speaker and all those others who were involved in this, and the governor were steadfast in their support to make sure we got this done. And we weren't not going to stop. We finally got it done, and I'm grateful and I'm happy that I'll no longer get surprise medical bills like I have in the past. But for the millions of New Jerseyans who are at risk every day, even up until we sign this bill, it's going to make a difference. Thank you all for coming out.
Well done. Well done. Let's take a couple of questions. A couple of quick comments, and we'll take a couple of questions. The staffs were extraordinary. I know that through our staff. So, Craig, to your team, the one staff person who I know the best is Lori, who is in a murderer's row over there with Craig's wife, Tish, and their son, and Carol, and Archbishop Gary Taffet, and Lord Artie Cifelli, and then, of course, Chairman McCabe at the end. But the staffs were extraordinary. Stuff like this doesn't get done just because principals think it's a good idea. And so hats off to each and every one of you. We'll call him right back. Before we take questions, Katie Jennings, where are you? This is your last day at Politico in New Jersey. Katie's, you're headed to Brussels. I told Craig yesterday afternoon, we were on the phone, and he said, what's up for tonight? And I said I was going to pitch New Jersey to, it turned out, 17 European Union consul generals. And I think we moved the needle, which is good news, trying to get folks to think more about us when they're talking to their host companies about investments. And everything is just calm over there in Europe right now in Brussels, so I'm sure you'll think it's a walk in the park after Trenton. So we wish you the very best. It's been great having you in New Jersey. Any questions before we break, please? So we had this scored in the budget, and remember, we presented the budget in the middle of March at $81 million. The bill has been a little bit tweaked, it's fair to say, over the past couple of months. So I don't have a precise handle. My guess is, at the end of the day, it's slightly less than that. I don't think it's meaningfully less, but that was the number that's in the budget. Katie. I thought it was I think the 81 is what we scored this at, but we'll come back to you. I'll get one of our folks to come back to you before you get on the plane. Do you have, okay, sorry. We got to allow you to ask a darn question, Katie. Yeah, you should come in here.
Yeah, we do, Katie. We worked hard to try to find a way to allow everybody in the state to take advantage of the out-of-network bill, and we think that the arbitration system, as we crafted it, will pass constitutional muster. We're confident of that.
Katie, I'm going to ask you, do you have any more? Because this is it, right?
And we know because... What time's that plane, Katie?
Matt, can we push the 350th anniversary back a little bit tonight, just to make sure we get others, please? Simple answer. I'm just glad we're agreeing we're playing baseball. Listen, I think, and I haven't had a chance, we just got that bill, so we're pouring through it right now. We've made a lot of progress on school funding. I think you'd agree with me over the past, both chambers as well as the front office. I actually think we're a lot closer than folks may think. The key is we got to find the revenues to fund that. That's a separate question, but I think on the formula piece, I think we've come a long way. I don't want to marry myself to the bill because I haven't had a chance literally to read it yet. Please. So I think what I'm going to stay with what because I haven't read this yet, and we don't comment on particular pieces specific of legislation. I think we're quite close, is my gut. I think we have to figure out how we pay for all this, but I think we're quite close. Anybody else in the press, in the back? You can't accuse me of not standing here after the last question, please. Yeah, I can't speak for him or for Brendan, but we released, or I didn't release it because it's their organization. They released the script of this yesterday, and it looks to me like it's an homage to a lot of what we've already done and we expect to do together. And I'll let Craig add his own 2 cents. There's also some speculation over the donor group, and I'm sure I'll take them at their face that they'll release the donors as they said they would. Frankly, the script looks so divisive, I wouldn't be surprised if the Russians are involved. Just a little something for you, Katie, as you head to Brussels. I think we're good. Should we sign this, baby? Let's go. Thanks, everybody.